My name's Gershon Kutsi and you're watching MeloTV. If you are expecting your first bundle of joy or planning to extend your family, you will require the services of a paediatrician. We now introduce you to Dr. Shukri Raban, who's based at Melomed Tokai and Melomed Gatesville. Here's Dr. Shukri Raban.
So I'm Dr. Shukri Raban. I'm a qualified paediatrician and I also am a subspecialist neonatologist. I practice at the Melomed Tokai and the Melomed Gatesville hospitals, and I've been in the group since April 2013. So I did my paediatric fellowship at Red Cross, and I completed my fellowship in 2009, and then subsequently immediately started the 2-year fellowship in neonatology at Groote Hospital.
You see children from birth till the age of 16. Tell me more about that.
So, as we spoke earlier, the pathways to a pediatric private practice are basically 4. We get our patients from the emergency unit, we get referrals from general practitioners, and we get referrals from maternity. So we attend normal deliveries and we attend cesarean sections, and then also parents come in depending on if they've heard about your practice from other parents. And then from a maternity perspective, we see them from birth, we'll see them at a cesarean section, we'll attend that birth, and we'll attend any difficult normal vertex deliveries. And we'll basically see the patient up until discharge, the baby up until discharge. In the first year of life, babies undergo significant changes. They can triple their weight in the first year, so they can easily go from 3 kilos at birth up until 10, 12 kilos in the first year. And their development is significant in the first year. They make the most developmental changes in the first year than any other period in their lives. Going from a very independent baby or dependent baby to a 1-year-old precocious infant who can talk, who has teeth, who's walking. So it's a significant change, and that's the period where you can also have abnormalities in the development or in the growth. And for the first year of life, we tend to see them quite often. Generally a 6-week visit, a 6-month visit, and a 12-month visit, and sometimes in between as well. And I'm sure you've also heard about the first thousand days and how important the first 1,000 days are in a baby's life. So that's basically the first 2 years. And so what you do in terms of nutrition and development is very important to a kid's life.
What advice would you have to a parent, first-time parent or parent watching this video?
For first-time parents, limit your Dr. Google inputs, because as good as Dr. Google may be, it also sometimes gets you frenzied and panicked about what may be wrong with your kid. I mean, typically you can punch in a few symptoms and it'll